do pre-hospital provider, because although we respond to patients in need, we call 911 so they go to the hospital. Because we don't have advanced care here.
On any given day and at any time, you could encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest. But with the training you receive today, your actions can give a victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, they are different conditions. But it's important to call emergency services for both. There's more information on the differences between heart attack and cardiac arrest in your provider manual.
Throughout today's course, we'll review the BLS skills you have learned previously, including adult BLS, child BLS, infant BLS, use of an AED, and high performance teams.
In this video, we'll revisit each skill and use practice while watching, where you'll practice along with the video. Before you're tested on adult and infant BLS skills, you'll have plenty of time to practice.
First, let's talk about the two adult chains of survival. One is for out-of-hospital cardiac arrest, and one is for in-hospital cardiac arrest. The two chains have 6 links, but the links differ slightly. Both chains include activation of the emergency response system, high-quality CPR, early defibrillation, post-cardiac arrest care, which may be provided in the cath lab or the intensive care unit, and recovery.
For the out-of-hospital chain, the difference is the 4th link, which focuses on advanced resuscitation. In this link, a multi-rescuer team arrives and takes over CPR and may perform additional advanced interventions. For the in-hospital chain, the difference is the 1st link. It focuses on early recognition and prevention of cardiac arrest with patient monitoring and assessment, and, if necessary, rapid response by the medical emergency team when a patient's condition starts to deteriorate.
In this practice session, you'll check for scene safety, check for responsiveness, practice chest compressions, and provide breaths by using your pocket mask with a one-way valve. You'll practice while watching by doing 3 sets of 30 compressions with 2 breaths.
Okay, when it says practice while watching, that means you're going to do something. So stand up, fix your mannequins, and I hope I'm telling you right. But you want to follow along with the video. So if they shake and shout to the patient, "Are you okay?" Call 911, get an AED, follow along the video. And it does not have to be in unison as long as you do it.
Here we go in 3, 2, 1.
Hey, are you okay? Are you okay? Okay. Help, someone help.
Check for the pulse with the carotid. And at the same time,
Activate the emergency response and get an AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
okay. Everything good. Just remember, Yeah, 30 to 2. And we'll talk about child and infant when we get to them.
In this section, we will cover use of an AED and a bag mask device. AEDs vary according to the model, but all operate in basically the same way. You must be familiar with the AED used in your particular setting. The 4 universal steps for operating an AED are as follows. Power on the AED and follow the AED prompts. Attach the AED pads to the victim's bare chest. Follow the placement diagrams on the pads. The AED will prompt you to clear the victim so that it can analyze the heart rhythm. If the AED advises a shock, it will tell you to clear the victim. If no shock is needed and after any shock delivery, immediately resume CPR, starting with chest compressions.
You'll need to consider a few special situations when using an AED. First, if the person's chest is so hairy that the pads can't adhere to the skin, you may quickly shave the area if a razor is provided. If no razor is provided and you have 2 sets of pads, apply 1 set to the hairy chest. If the chest hair prevents the pads from contacting the skin, the AED should tell you to check the pads. If it does, press them down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then apply a new set of pads to the bare skin.
Excessive water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If a victim is lying in water, quickly move them to a dry area before using an AED. But if the victim is lying on snow or in a small puddle, you can use the AED. And if the chest is covered with water or sweat, wipe it off before attaching the AED pads, but wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump that's smaller than a deck of cards. If you see this lump, avoid putting a pad directly over it. Also, don't place a pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before applying the pad. If the victim is wearing an undergarment containing metal, be sure to apply the AED pads on bare skin, avoiding contact with the garment.
You should familiarize yourself with the AED model in your workplace. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. AED kits may include additional emergency equipment, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on a victim.
We're going to do the
Providing effective
Bag
ventilation
mask
is
first, and
critical
then
to
we'll go back to
successful
AED.
high-quality CPR, especially in respiratory-related emergencies such as drowning, anaphylaxis, and asthma. Guidelines recommend against excessive ventilation during CPR, and research suggests that some rescuers are less confident and less effective when using a bag mask device on their own without assistance. Because using a bag mask device is such an important skill and is common in the healthcare setting, we'll work on it now. Bag mask devices consist of a ventilation bag and a face mask, and they come in a variety of sizes. You can also use supplemental oxygen with a bag mask device.
To begin, position yourself directly above the person's head. You'll use the EC clamp technique to hold the mask in place. To do this, apply the mask by first placing the cushion at the narrow end of the mask onto the bridge of the person's nose. Then lower the mask fully onto the face, watching for the cushion to bulge as it initially seals against the face. Form a C with the thumb and index finger of one hand and press down on the dome of the mask toward the face to further seal the rim of the mask. The remaining 3 fingers of that same hand should form an E to reach past the edge of the mask along the bony rim of the jaw. To tilt the head back, lift the jaw toward the mask and open the airway.
Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and the face, and squeeze the bag with your other hand or push it against your leg or body. If the chest doesn't rise with each breath, you're not providing adequate breaths. If you don't get chest rise, readjust the mask, reposition the head and neck, and try again to ventilate. And then, only if necessary, administer a larger amount of air, just enough to get chest rise.
The critical points of delivering breaths remain the same for the bag mask device as for the pocket mask. 2 breaths are given, with each breath given over 1 second after every set of 30 compressions. Be sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation, or air going into the person's stomach instead of the lungs. Gastric inflation can cause vomiting and possible aspiration.
If you have multiple rescuers, the most effective way to deliver breaths with the bag mask device is to use the 2-person technique. One rescuer focuses on keeping the airway open and securing the mask, while a second rescuer squeezes the bag to deliver breaths, just enough to cause the chest to rise. The first rescuer will use both hands to seal the mask to the person's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face, and the 3 remaining fingers of each hand will form an E for lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, which could push the jaw down and block the airway.
Now it's time to practice the 1 rescuer bag mask technique, so that in a few minutes, we can combine it with compressions to work on a 2 rescuer sequence. We'll pause here to get into position.
Get your mask ready. Attached to that. And it is easiest if you do have the head to work through. And you can use your head, your body for leverage. Okay. You able to ventilate? There you go. All right.
Now that we're ready, let's practice using the bag mask device. Follow along with the video. Here we go in 3, 2, 1.
Yeah, he's slow-mo. He doesn't get in a hurry. I would have had 20 breaths.
Give 2 breaths.
You need to do slow breaths.
Watch for chest rise. Give 2 breaths. Give 2 breaths.
Everybody doing awesome?
Give 2 breaths. And give 2 breaths.
Okay, since it pauses, this is a good time to do the AED. Sometimes this video, when you stop it, it won't restart. You have to start at the beginning. So that is the reason we're doing the AED now. So what is the first thing you're going to do?
Turn it off.
You do not do anything else except turn it on, and it will let you know what to do.
Apply pads to patient's bare chest. Patient's hands connected next to flashing light.
Yep.
Analyzing heart rhythm. Apply pads. Plug in connector. Do not touch the patient.
Clear, clear.
Shock advised. Apply pads. Plug in connector. Stay clear of patient. Analyzing heart. Analyzing deliver shock now. Press the orange button. Do not touch the patient.
Go ahead.
Shock delivered. Shock advised. Shock begin CPR. Charging. Stay clear. Stay clear.
Every
of
time it
patient.
says say clear, say clear.
Deliver shock now. Press the orange button now. Shock delivered in CPR.
Okay.
CPR.
Once you deliver your shock, they're gonna automatically start CPR. And that beeping you hear, that's the rhythm. Okay. Turn your AEDs off. It's loud. Okay. Meetings. We need to pause it for a while and we'll listen to the video. We can always restart it.